Hello everyone and welcome back to the Best PT Podcast. This is the first bonus episode talking about the temporal mandibular joint, the TMJ. Let's talk about TMJ anatomy. So this joint serves as the articulation point between the mandible and the temporal bone. The hyoid bone here serves as the distal attachment point for tongue and facial muscles. The articular disc of the TMJ divides the joint into two separate joint spaces, a posterior and an anterior joint space. The joint has four ligaments: the lateral or temporomandibular ligament, the sphenomandibular ligament, the stylomandibular ligament, and the stylohyoid ligament. There are four main muscles of the TMJ. They're all innervated by the trigeminal nerve or cranial nerve 5. There's the temporalis muscle, which performs elevation, protrusion, and ipsilateral deviation. The masseter muscle performs elevation and ipsilateral deviation. The medial pterygoid performs elevation, protrusion, and contralateral deviation, and the lateral pterygoid performs depression, protrusion, and contralateral deviation. The TMJ has five main actions: depression or opening of the mouth, elevation or closing of the mouth, lateral deviation of the jaw, and protrusion and retrusion of the jaw. Talking a little bit about teeth. There are 8 incisors or front teeth, so 4 from the maxilla and 4 from the mandible. The incisors mainly cut food, and it's normal for the maxillary incisors to be larger than the mandibular incisors. There are 4 canine teeth, 2 from the maxilla and 2 from the mandible. The canines mainly serve to cut and tear food. There are 8 premolar teeth, 2 in each quadrant, so upper left, lower left, upper right, lower right. These serve to crush food. And then finally there are 8 to 12 molars, 2 to 3 in each quadrant, so again upper left, upper right, lower right. And these molars serve to grind food. And the variability here is that the third set of molars are the wisdom teeth. So some people have no wisdom teeth, some people have all their wisdom teeth, and some people have a combination of this third set of molars. And teeth are important when talking about TMJ and TMJ disorders because missing teeth or misaligned teeth can lead to TMJ disorders. Talking a little bit about orthokinematics of the TMJ. When we look at depression, it's a two-part motion where the mandibular condyle rotates anterior on the articular disc, and then the condyle and disc glide together in an anterior-inferior motion along the articular tubercle of the mandible. This occurs mostly with assistance from gravity because there's only one muscle that actively performs depression. Talking about elevation, it's simply the reverse of depression, however it involves more muscular activity with the involvement of the temporalis, the masseter, and the medial pterygoid muscles. Protrusion and retrusion. So when the mandible and articular disc move anterior, that's protrusion, and when they move posterior, that's retrusion, and these movements occur against the articular fossa of the temporal bone. And finally, lateral deviation occurs when ipsilateral mandibular condyle rotates around a vertical axis, while the contralateral condyle glides anterior. Medial deviation is not an actual motion, it just occurs as a result of the lateral deviation muscles relaxing. And finally, TMJ positioning. The resting position of the joint is with the mouth open or depressed, lips sealed, and teeth not in contact. The closed packed position is with the teeth fully clenched and the masseter fully engaged. And the capsular pattern of the joint is depression is more limited than the other motions. That's it for bonus episode 1 talking about the TMJ. The next episode we'll talk about temporomandibular disorders or TMD. The outline for this episode will be in the show notes. Thanks for joining me.